When people feel loved and they feel cared for and they feel like somebody is concerned about them, they just do better when they feel a sense of connection.
I think health really intersects in every area of someone's life. From our perspective, if somebody has injuries related to an assault or has experienced a sexual assault, they go to the hospital for medical treatment, but then the hospital has to engage their crisis response team in figuring out, is this person safe? Do they need extra supports? What resources can they get connected with? And so the hospital is really tasked with knowing how to make those connections and making sure that people get to the support systems that they need.
If we want to be seen as a compassionate community and a community that cares about these kinds of things and a community that does something about these kinds of things, these are the systems that we have to sustain. So we've been working a really long time to get to this point, and the partnership that we have with St. Peter's Health, because it allows us to really respond to someone where they are.
You know, if I had all the money in the world, I would put a mental health professional in the car with one of my officers. We're dealing with people in a mental health crisis all the time, every day. I'm not gonna say every hour, but it's constant. And to have that person working right alongside an officer and going to the same call, and when the officer clears it, that person's right there and can start addressing the crisis that person's in.
So law enforcement dispatches mobile crisis response to anybody they see that is in distress. So they bring us in so we can evaluate them, do a crisis evaluation, sometimes a mental health evaluation, and then we do a safety plan, and we do our best to kind of do a warm handoff to the resources we're connecting them to.
We need to look at someone's history. This didn't happen overnight. And as we know, mental health is cyclical. Alcoholism is cyclical and hereditary. We need to be open-minded to look at people, to what's happened in their lives.
I just keep going back to this idea of connection, like feeling supported by the people around you and not feeling like you're alone. I think that can keep people healthy and positive, and a lot of the families, kids and families I've worked with have had a lot of challenges in their life, and this feels like one tiny way to hopefully prevent or help a family avoid some of those challenges. So it felt very preventative in nature, which I appreciate.
We all eat. It's something we can all get on board with. There's maybe a disconnect from how much the food we eat really impacts our overall health. Mental health has been linked to the food that we eat. It's hard for kids to pay attention in school if they don't get a good, nutritious breakfast. So starting off our day with good foods can really have an impact on our health. And that's what I tell the kids when I go into the schools. No, I'm not a doctor, I'm not a nurse. I'm here to help keep you out of the hospital. I want to make sure that you make healthy choices now to prevent chronic disease later in life and help your families do the same thing.
This consistency that we've had over the last few years with St. Peter's Health engaging with the community in this way, in partnership with the county and other partners in the community, it's a much more cohesive and organized response. Ultimately, we get better outcomes. And the likelihood of us sustaining this is much greater because there's a sense of shared responsibility amongst us.
We work very closely with the advocates from the Friendship Center. For every victim that comes into our emergency department, we have an advocate from the Friendship Center come, and they're there throughout the entire exam to provide support and reassurance and resources for the victim.
And then also making sure that people know they're not alone when they're experiencing it. Domestic violence in particular, but really all of the issues thrive in secrecy and isolation. And so the more that you can widen those supports, the better off everyone is. I think the biggest barrier that we are encountering is everyone is significantly over capacity for the demand that we have in our community. All of the agencies were already pretty much maxing out on their capacity before we had this huge influx of people moving into Helena. You have more people who are accessing all of the resources, and the ability for agencies to pivot and keep pace with that demand is really, really challenging, especially when you think about how a lot of us are funded, which is primarily fundraising.
And it seems like most of the problems that I encounter on a day-to-day basis aren't so huge that you can't help them. I mean, sometimes they're giant and you don't know what to do. And then that's where you have this team, this whole community. And if you've ever been a part of or on the receiving end, then you really do understand it.
When you say you're a nurse, people are always so excited. And when you tell someone you're a forensic nurse, they go, oh, wow, that must be really hard. Why would you do that? My first line of defense is always saying, nursing is hard. All forms of nursing is hard. There's no one field in nursing that's all sunshine and rainbows. And just because it's hard doesn't mean that no one should do it.
I have seen people only once, and then later I see them in passing and they're doing well. And they tell me they're doing great, and I love that. That's amazing. Our job is to weed out people, not to keep seeing them and keep seeing. Our goal is not to see them again, and that feels good.
I've been a police officer for 20 years. I think ultimately what made me stay here was the investment in the community. Once you get here 3-4 years, you start having a family of your own. Your kids go to schools. You get more and more invested in the community to where you live. And next thing you know, it's been 20 years. You look back, and I guess I've been in Helena for 20 years, and it's the longest place I've ever been. This is my home.
I don't know that I feel important enough to have that sort of impact. And there's a part of you that just feels like I didn't do anything special. Like you shouldn't give me that sort of credit. I'm glad for it, don't get me wrong, but I feel like there's a part of me that just says, I'm doing what I was called to do.